What are your recommendations for everyone in the audience to take home? What should they be doing when they go back to their communities and their hospitals in terms of committees and pushing, or leading there?
If I had one message to tell our PAs, it's that you are valuable during these type of responses. You are valuable when there is a mass casualty event. You are valuable when there is any sort of internal, external disaster, whether you are in the field or whether you are at home or whether you're in your hospital. You've been trained and you should be there if you can be there. You should also be at the table when there's planning being done. I think sometimes the PAs aren't part of the conversation. So go back and be part of that conversation.
The first word is preparedness. You have to be prepared, and you guys have to be prepared on two levels. One is professionally, and as was said, you have to be at the table, you have to be participating, you have to advocate for your team and get your team involved and in the mix, because again, you need to have, just like with sports events, you wouldn't go to a sporting event without practicing. You need to practice with your team. So that's on a professional level. The second thing is on a personal level, because as was said, all of you people have a tendency to run into the fray, and that leaves your family behind a lot of the time. So your family has to be ready, and you have to have a family plan so that they're tucked away while you're taking care of everybody else.
You may think that you're not prepared for these type of situations, but I mean, we're trained to be flexible. We're trained to be, in the ER, in the OR, in the clinic, and you need to be able to pull upon that and trust your training that this will, this is why you're a PA and this is why you're out there. This is what you're meant to do.
I think in addition to that, I would say that sometimes preparedness has to do with knowing where to be at the moment. And sometimes it has to do with knowing when not to show up as well. Because we had a wonderful outpouring of volunteerism amongst our medical community. But when you have 100 physicians who neurologists and urologists and pathologists who showed up to the emergency department and wanted to help, remember, somebody has to take the overnight shift. Somebody has to be there for those same load of patients the next morning. So especially if you're in a small place, by all means show up, but be flexible. Be ready to do whatever's needed, whether it's within your wheelhouse or not, and I think PAs are probably the best in the medical community at that, but also be ready to turn around and go home if you're not needed right now, and be the person who's responding to the event 12 hours later, 24 hours later.